friends, this is Dr. Ghosh. Welcome to my channel, Dr. Ghosh Presents. Today's discourse is subject cardiac arrest. Title: Why is cardiac arrest much more serious than cardiac attack? You can be a lifesaver. Why is cardiac arrest is much more serious than cardiac attack? You can be a lifesaver. See, cardiac arrest, it arises from anomaly in the conduction system of the heart. In the heart, inside the heart, there is an electrical conduction system like wiring in our house. That electrical conduction system arises impulse at the rate of 75 per minute. That's why heart beats 75 per minute. Now when this electrical system goes out of order or give some trouble arises, this pulsation changes. It may come down, it may go up. And when it suddenly stops, then full cardiac arrest occurs. And that is a grave emergency. Grave emergency, present first symptom, gasping. Patient will gasp. Second symptom, unconscious. Third symptoms, no breathing. Fourth symptom, no heartbeat. So this is the four symptoms comes within minute, and if the bystander cannot help the victim, he will certainly die within a minute. It is acute emergency. In cardiac attack, we get some time. 2-3 hours time we get. During the time, we can take the patient to hospital, doctor can attend. But here, there is no time. The person who is just standing beside him, the person just fell down, he is unconscious, there is no breath, immediately CPR is to be started. But in case of cardiac attack, we get time to transport the patient to hospital, and a few hours. But in cardiac arrest, this is not available. That's why cardiac arrest is much more serious than cardiac attack. So every one of us must know what to do here. Every one of us. This is cardiac arrest. Now what to do? Only one thing you can do, that is called CPR, cardiopulmonary resuscitation. Cardiopulmonary resuscitation is a process, is a physical process that is applied upon the victim, that we will show in a video, small video, because that is a drill actually. That is a drill. That is immediately is to be applied on the patient, and someone will continue this till doctor or emergency ambulance comes to transport. Even while transporting, this CPR will be constantly applying on the patient, because this is the thing which will keep the patient alive, if at all possible. This CPR, cardiopulmonary resuscitation, will keep the patient alive. It is such an emergency situation. Everybody should know it. Now we will show in a documented manner, written form. This much for oral delivery.
Today's discourse.
Cardiac arrest. Title: Why is cardiac arrest much more dangerous than heart attack? You can be a lifesaver. You already know the signs and symptoms of cardiac arrest, CA. Sudden collapse, cessation of respiration, and stop of heartbeats. These trio are sufficient to indicate onset of CA. In heart attack, we got some time to take the victim to hospital. This occurs due to block of blood circulation in coronary artery for plaque. But in this condition, heart as well as lungs are functioning. But CA occurs due to severe troubles in the electrical conduction system, ECS, of the heart. Impulses generated by the ECS make heart to throb 75 times per minute. If the impulse stops suddenly, heart too stops suddenly. As heart stops beating, blood cannot reach brain where centers of control of heart and lungs are seated. So lungs and heart stop their normal work. The victim loses consciousness in a minute. Within next minute, if the heart and lungs are not innervated to start work, the victim dies. So CA is much more dangerous than HA. So a life-saving procedure called cardiopulmonary resuscitation (CPR) is applied on the victim manually to keep lungs and heart going. A video is coming up to show how CPR is applied on a patient. CPR has got two phases. First 30 compression, then 2 rescue breaths, then again 30 compression and 2 rescue breaths. This cycle would go on continuously until doctor arrives. But only a trained personnel can do this. If such a personnel is not available, then anybody can continue just 100 to 120 compressions per minute, and he must continue this until doctor attends the victim. We must remember that this simple monotonous drill is effective enough to keep the victim alive so long it is continued. So it is requested that this must be continued. This must be continued. After the video, the discourse is finished. Thank you. Open the chest of the victim. Place the heel of the right hand on the end of the sternum. Then place the left hand over the right as shown. Now press on the chest and release the same as shown in the video. Do this 100 times to 120 times per minute. You have to continue this till doctor arrives and the patient is taken to hospital or nursing home. Please mind that on this simple monotonous job of compression and release, the life of the victim depends. Our presentation ends here. You have gone through the whole session. Now please give your comments as to the quality of this presentation. How this could have been much better, what should have been added, or what should not have been added. I'll be waiting for you so that I can give you my best presentation in the coming days. Thanks for the time and attention.